Are you able to see my screen? If you can, just type yes in the chat box, please. Kulvinder, if you want to say something, please put down your question in the chat box. All right, thank you for that confirmation. So, this is what we'll be discussing today, how to write with clarity. Now, I'm sure you're all aware of what is the step-by-step technique or strategy for OET writing exam, right? The first step is to select relevant information for your recipient, keeping the purpose of letter in mind. The second step is to decide the order of that information, of how you're going to present that in order of importance for the reader. And then we start transforming that information to complete sentences. And at that stage, we've identified some mistakes that are common to students. And that's why I've designed this lesson, keeping in mind what are the mistakes that students make and how to improve them. So these are the 5 areas that we will be discussing. Students, when they don't write clearly or concisely, what does the word concise mean to you? Type in your answers in the chat box, please. What does the word concise mean to you? What is your definition of this word? Short form. Yes, Apender, that's correct. To present in small form. Yes. Okay. In lesser words. Good. The shortest or in a very brief manner. To present your information in a brief manner. That's concise. Just a minute while I'm admitting students. I'm sorry. Then the second is poor grammar. In this, there could be errors related to your tenses, related to using time markers like for, since, and ago, which we'll discuss in this class as well. We'll be reviewing 2 important tenses, but I plan to make this PPT available to all of you, and I would like you to review it. It's important to understand tenses and their aspects, because conveying time relationships are very important in OET. This can compromise the quality of care of your patient, right? If you somehow misrepresent when an event happened, when is something to be done. So always make sure that you have brushed your knowledge about tenses and their aspects. I see a lot of students are joining. I might just need to repeat everything that we've discussed. All right, for those of you who've just joined, please keep yourselves on mute throughout the class. If you have a question, put that down in the chat box. That's at the bottom of your screen. What we are discussing today is how to improve your writing for your OET subtest, OET writing subtest. And we discussed what is the strategy, what is the exam technique, and that is for selecting relevant information for your recipient. The second would be deciding in what order you want to present that information for that would be relevant or important from the reader's point of view. And when you do that, and you start transforming those case notes, the relevant information that you've selected, you transform them into complete sentences. And at that stage, we've identified some errors that are common to students, and we'll be discussing them in this class. And then how to avoid them, how to make your writing clearer and more effective. So the first one was not writing clearly and not writing concisely. So we need to write in a concise manner, which means in a brief way, using the shortest words possible. In a simple manner, not necessarily meaning simplistic, but simple, something that is clear for the reader. The second area would be using poor grammar, which would include errors related to your tenses, their aspects, you're using correct time markers with your perfect tenses. The third error is not connecting your ideas logically to prioritize key information. Now, by key information, we mean in that piece of information which deserves attention or importance from the reader. So we'll see different types of sentences, how you can use them appropriately to create an impact on your reader. Then the fourth area would be informality of language. In this, we'll discuss errors like students use sometimes contractions or even the choice of words for that matter. So we'll discuss how do you have to sound formal, how to keep the tone of your letter formal for the reader. And the last would be incorrect punctuation. And all of these mistakes, they relate to different assessment criteria in your writing exam. So let's move on to the first one. Writing clearly and concisely. I've used a quote from Shakespeare, brevity is soul of the wit, but we sort of modified this for a writing exam. And so the brevity is the soul of your letter. What do you think the word brevity means? Oh, Abhishek is asking, what is the meaning of brevity? Can you guess? Have you ever heard of this word, brevity?
गुरुत्वाकर्षण मैम.
Yeah, can you type your answers, please? Try to keep yourselves on mute. And if you want to answer, can you use the chat box? So brevity means writing in a short manner and using precision with your words, using accurate meaning briefly. Thank you, Meenakshi. Briefly and choosing words with accurate meanings. These are the 6 tips that I have for you for writing clearly and concisely. The first one is embrace brevity, which means write in a concise manner. Aim to communicate with the fewest words possible. Second one is avoid redundancy. What do you think redundancy is? Sometimes using words unnecessarily. Sometimes 2 words that are placed together convey the same meaning. And we'll discuss the examples in this class, but that's what we need to avoid, using words unnecessarily. The third one is using words that you fully understand, prioritize precision. Use words that have exact meanings, avoid words that convey generic information. Look for a word that conveys exact meaning. Then using active and passive voice appropriately. We'll discuss them in the class as well. Normally there's a misconception among students that passive voice is to be used for formal writing, but that is a myth. In OET exam, it's more to do with what is appropriate according to context. So you can use both active and passive, but what will determine what voice is to be used? That we'll discuss when we understand where active voice is to be used and where passive is to be used. So we'll discuss them in the class, but always remember, it is a misconception when students say that use passive voice to sound formal. No, we will understand where these types of voices, where active is to be used, where passive is to be used, and then that should decide what is appropriate for the reader. The fifth one is combine sentences to create a logical flow of ideas. This is quite important. If you write sentences, simple sentences, and you don't combine them appropriately, where there's a relationship or where it makes sense to combine them, your writing can become very choppy. that wouldn't be sophisticated way of writing. So we learn how to do that in the class, how you can combine ideas or sentences to make it clearer for the reader, using linking words and phrases to guide your reader. We've done lessons on signposting, right? Some signposting is when you guide the reader about time relationships. It can be to establish a relationship between the ideas, to guide the reader through the information that you're presenting. So discourse markers, transition words, linking words, whatever we want to call them, we must use them to guide our reader. All right, let's come to the first one, verbosity, which we were discussing. To ensure that the letter is engaging, you should avoid verbosity, which means using excess words to convey the same meaning. Now, I want you to look at these two sentences in the screen. The first one, she has been a patient of obesity since childhood. And then compare the second sentence, she has been obese since childhood. Which one, although it's mentioned on your screen as well, but is the first one clearer or more effective, or the second one? Which one would you prefer if you were the reader? Which sentence would you prefer in your letter if you were getting this information in the letter? The second one, everyone agrees, right? So similarly, there are going to be many examples, and I have selected a website. In fact, let me put that down in the chat box right now, where you'll find many examples. You can use this website to see common examples. For example, in order to, instead of 4 words, you can just use 2, the preposition to. So there are examples in day-to-day life also. Sometimes we don't realize, and when you keep repeating your mistakes, they start to sound natural. But always keep it in mind when you're proofreading, when you're revising your paragraph at the sentence level, see if you can use fewer words to convey the meaning. Then the second mistake that we discussed was redundancy, which is when words with the same meaning are placed together. Now, I want you to look at this sentence. Her past medical history is significant for. Past and history. Can you think of a word to remove from this sentence? What word can be removed? Past. Yes, correct. Because history, the word history means record of the past. So this word here, past, this is not conveying any new information. Even if we remove this, the meaning of the sentence remains unchanged, because history means something of the past, a record of the past events. Now, the website that I was talking about, I've mentioned that here again. Most common redundancy, this is something that I hear people using when they're speaking or in writing as well. Can you repeat again? Can you tell me which word would be removed here in this example? Repeat again. Which word should be removed to avoid redundancy? Can you repeat again? Can we remove one word? Again, very good. Excellent, Meenakshi. Well done, Kaval. Harshvardhan, yes. And in this website that I've shared, you'll see plenty of examples. So I want you to make sure that you go through every example. If you find something that you've been doing that, make sure you make a note of it in your notebook and then don't repeat it. All right, we have an exercise now. And rather than giving you time to do this, let's discuss it one by one. So Can you think of a concise alternative for these wordy phrases that are mentioned? And you have to choose an answer from this box below. So let's do the first one together so you understand how we're doing this. As a result, 3 words. Can we think of one word, or can we choose one word from the box at the bottom of the screen that would convey the same meaning? Consequently. Consequently is the answer. Consequently means as a result of. So rather than writing as a result of this, use the word consequently. This is a linking word. What about the second one? Has the ability to. Can. Very good. Excellent job. What about the third one? On a regular basis. Regularly. Well done, Meenakshi. Okay, fourth one. For the reason or for this reason. For this reason, therefore. Very good, Jaspir. For this reason, therefore. Owing to the fact. Yes, Kaval, you're right. Yes, Siddesh, because is the correct answer. At the present time. Presently. Very good. Can you think of another word for presently as well? One word. Currently. Very good, Harshvardhan. Currently, yes. In addition to this, additionally. Excellent job. Then in order to. Very good. I think we discussed this example in when earlier when I was explaining about redundancy. Then in respect to. Regarding. Very good. And in spite of the fact that. Although. Very good. Yes. Great job. All right. We have another activity, and this is again based on the tips that we discussed earlier, combining sentences. Now we have two simple sentences, and they're based on the case notes on your screen. So let's imagine that we are referring a patient whose spouse has passed away, and the patient lives with her daughter and son-in-law. And these are the two simple sentences. So we've transformed these case notes into complete sentences. The first sentence is, she lives with her daughter and son-in-law, full stop. She is a widow. Can we combine these sentences? Okay. Before that, I want to ask you a question. Should we combine these sentences? In your opinion, do you think it makes sense to combine these sentences? Yes. And why do you think? Would anyone like to mention the rationale as well? Why do you think it makes sense to combine them? Amit says no. Amit, I'm also curious to know why you don't think it doesn't make sense to combine them. Okay. For conciseness and clarity. Yes, Harshvardhan. Both these pieces of information are about the social situation of the patient, right? So we could present them in a single sentence as well. And how can we combine them? How do you think we can combine these two sentences? Using linking words. Can you type in your answer in the chat box, please? Kulvinder, write the complete sentence. She is a widow. Therefore, she lives with the son and daughter. I think we can do it in a better way. So she is a widow who lives with her daughter and son. Socially, she is a widow and lives with her son-in-law and daughter. Very good. Yeah, I think we can use and to combine them. How we can do that? If you see these both sentences, what is common to these? The subject, right? She is the subject of the first sentence. She is the subject of the second sentence. Predicate of the first sentence, lives with her daughter and son-in-law. Predicate of the second sentence, is a widow. So if the subject is common, we can combine the predicates. And this is how we can do that. She is a widow and lives with her daughter and son-in-law. So because the subject is common in these sentences, we've just combined the predicates together. We've actually done a lecture on this in the class as well. If you'd like to understand this in detail, you can text in the WhatsApp group and I shall share that lecture with you. But this is a good technique of combining sentences that are related to each other. It also should keep it in mind. It's not important to combine everything. The principle here is, or the important thing to remember here is that the ideas you're connecting or combining should be related to each other. So we decided to combine them because they're a part of a social situation and they're related to each other. All right, we have a question. Can we make the first predicate with a comma? No. See, when there are two items, you use an and. We start to use commas in a list with 3 items. So we'll discuss the rules of comma in the class as well. But when there are 2 items you're combining, you can use and. Can we use a relative pronoun? Who? Yes, you can do that. And there was an example that I read out as well. She is a widow who lives with her son and daughter-in-law. Sorry, with her daughter and son-in-law. All right, we have the next activity now. Read these sentences and then choose a linking word from the box that conveys the relationship between the ideas clearly. Before you choose your answer, read these sentences and see what the relationship between the ideas is. Then you'll instantly get your answer. And once you're sure of your answer, once you're certain, you can put that down in the chat box. That's correct, Habiza. Raman, that's correct. Well done, Kaval. All right, what do you think is the relationship between the ideas? He has been able to recover as a result of the exercises that he has been doing. And we already discussed in the previous activity What can we use instead of as a result? Consequently. So that's the correct answer. All right, before we move on to the next section of active and passive sentences, are there any questions that you would like to ask? Okay, great. Let's move on to active and passive now. Where do we use active voice? When we want to draw attention to who performs the action. That's the focus of the sentence, and that is our subject. There's an example that we should read together. Mr. Singh accidentally took an overdose of sleeping pills. Why did we use active voice here? Because it's important to tell the reader who took an overdose of the sleeping pills. That's why we want to draw attention on who did this action, the patient. So that's why it would be more appropriate to use active voice in this case, not the passive voice. So use active voice when the doer of the action is important. Then let's see passive sentences, passive voice. When do we use it? To emphasize what was done or who it was done to or done on. When the subject is unknown or it's unimportant to mention. For example, see this. On admission, comma, a CT scan was performed. Here we haven't mentioned who performed the CT scan. So we've omitted that part. But it will convey the information that who it was done to for the patient. And that's what will be relevant for the reader. So in passive voice, what happened, what action happened is more important than the person who performed the action. For example, if your case notes have this information that patient is being discharged today, you don't need to write, I discharged the patient today. No, it would be appropriate to use passive voice there. The patient has been discharged. And you don't even need to write by me. Just the fact that the patient has been discharged is what would be relevant for the reader. Any questions so far? Okay. Now your exam tip. People often believe that passive is more formal. However, it depends on the context and what you want the reader to focus on. Learn why active or passive sentences are used, when they are to be used, and the impact these will have on the reader, and then choose which one will be appropriate or which one is to be used. Let's see application of this knowledge with this activity. Now, expand the following case notes into sentences using active or passive wherever it's appropriate. First, I want you to just expand the case note into a complete sentence. Then I want you to think about which voice is to be used, what would be appropriate to convey this information for a reader, for a health professional. Let's do the first one first. If you have your notebooks with you, or if you have a pen and paper with you, just first expand this, transform this information into a complete sentence. Then think about what would be appropriate, whether active voice would be appropriate for the reader or passive. And once you've done, once you're certain of your answer, put that down in the chat box. Kulvinder, type the answer as well, please. Type the answer, Krishna. Very good, Amit. He or the patient was discharged from the hospital on 22 August 2022. Good, Kamal. So active voice would be appropriate here. Or passive. The action discharge, is it happening to the patient? Is it important to mention who discharged the patient, or is it just important to mention that the patient has been discharged or the patient was discharged? Passive, passive. That was a trick question. Passive is appropriate here because the information that the patient has been discharged, that's relevant for the reader. Who discharged the patient? That's unimportant. Then we come to the second one, CPR given by paramedic. First, transform this into a complete sentence. Then think about what would be appropriate, active or passive. Why do you think passive, Habiza? Don't you think the doer of it's a medical procedure, right? CPR. So the doer of the action, who did this action on the patient, that's also important, I believe. So active would be appropriate here. Let's see the answers as well. First one, the patient was discharged from the hospital on 1st August 2022. Passive. What happened is more important than who did it. The second one, CPR was given by, a paramedic administered CPR. Doer is important here. Who gave CPR to the patient? Even if we write it in passive voice, the doer would be important because I believe that CPR is a medical procedure, right? So if we are conveying this information to the reader, you would probably want to tell the reader that this was done by a health professional or somebody who's trained in that procedure. So a paramedic administered or gave CPR, full stop. All right, now we have a consolidation activity. Think about all that we've discussed till now about keeping it concise, about avoiding redundancy, using active and passive appropriately, about combining sentences where ideas are connected, about using relevant transition words or linking words to guide your reader to establish ideas between your sentences. So I'm going to give you 3 minutes for this. You have to revise this paragraph for concision or apply all the 6 tips that we discussed in the beginning. Please note that this paragraph that you're seeing on the screen is grammatically correct. There are no grammar mistakes here. What we're trying to do is improve your style of writing. So I'll start the 3-minute timer now, and then we shall discuss the answer. I would prefer it if you were to write this down in your notebooks, and then you can compare your response to the answer that I display on the screen. Of course, there is no one correct way to do this. This can be revised in various ways. I will just share one of the answers that I've written down for everyone, but I would love to see your responses as well. So I'm starting the timer now. All right, the time is up. Before we discuss the answer, can I request the students who are there in the writing WhatsApp groups with us? Can you take a snapshot of your response and share it in the WhatsApp group, please? I would like to look at your responses later. Please make sure you do that. And here is a sample answer. Sample. That means there's just not one way to do this. This is not the only way, one of the ways. Now let's see how we've revised this paragraph. And I've used a little bit of color coding. So let's see the sentences in light blue first. She first presented on 7th Feb 2018. The patient complained of frequent symptoms of productive cough that began 3 days ago. The productive cough was also accompanied by fatigue and fever. So what did we do? We combined, we shortened the information and we combined the sentences 2 and 3. So we can also write like this: initially, comma, on 7th Feb 2018, comma, she presented with. That is another way to write. Or what we can do is we can write during her initial visit on, comma, and then she presented with. So here, I mean, if you compare this to the version on the left, that looks a little choppy, unsophisticated way, right? So we just combine that information. So we discussed two ways. Initially, comma, on 7th, she presented, or we can also write during her initial visit on 7th, then patient presented with a 3-day history. What we did is now to mention the duration of when the symptoms began. In front of the noun history, we made this into an adjective, the duration, 3-day. And you can use this if you want to mention the duration of the symptoms when they started, X-day or hour, whatever it is, the unit that you want to use. But you can, this is how you can make your writing concise. She presented with X day history of, and then mention the symptom when that began. And then we combined the symptoms also. So here we used commas in a list. So going back to the question that Kulvinder asked, that can we use commas? You use commas when you are separating items in a list. 3 items and more, that's when we start using commas. So first 2 items are separated with a comma. The last item is the list is separated from the list with a comma and. Then look at the sentences in pink. A physical examination was done in which her vitals were recorded as remarkable. Now this I feel is redundant because the next sentence mentions what was remarkable. So why write this? We can simply go and mention, we can simply mention what is the remarkable finding. That will save the reader's time also. Scattered bronchi were heard over lung field. All of the symptoms were consistent with a case of acute bronchitis. And this became an examination that they revealed scattered bronchi over lung field, based on which an assessment of acute bronchitis was made. Then the next sentence was, I then prescribed amoxicillin 500 milligrams TDS to the patient. I also asked her to come back for a review after 2 days. Now, I want you to focus on the semicolon here because these sentences are closely related. Like, why was amoxicillin prescribed? Why was the patient asked to return for a review? The treatment plan. This was done because of the assessment that was made. So these sentences are related to each other. And when sentences are closely related, you can use a semicolon between them. And we also used a linking word, therefore. You remember what was the meaning of this word? For this reason, or for the reason. So because the treatment plan was done because an assessment of acute bronchitis was made. So it makes sense to use this word here. And that's how we used a semicolon and then a linking word, comma. And then next we changed the active sentences to passive. Why? Because the action is important, not the doer. The action, what happened, what treatment was prescribed, that's more important than who did it. Okay, let me also read Dr. Amandeep's response. She presented on 7th Feb with complaints of 3-day history of frequent cough, which was accompanied by fatigue and fever, full stop. Examination revealed vitals were remarkable with scattered bronchi over lung field. All symptoms were consistent with acute bronchitis. And the patient was commenced on amoxicillin 500 milligram 3 times a day and was asked to review after 2 days. Okay, excellent. This is a good response, Dr. Aman. Well done. Any questions about this? Or if you have your own responses that you would like me to see or go over? Okay, we can see them in the WhatsApp group later. But when you get time, I'd like you to see Dr. Aman's response as well. She's written well. Okay, the next would be grammar. Now, there are 2 common errors here. Capitalization, this is quite common. In all the letters that I have assessed or assess, I see capitalization mistakes very common. And then I've listed about the time markers for since and ago. And because I will make this PPT available for download, so you can go over the teaching component as well. We are going to go straight to the exercises. We're a little pressed for time. And what tends to use to write about a patient's diagnosis. Okay, about capitalization, common pitfalls or common errors. Usually students get confused when to capitalize the name of medical condition. So you should capitalize the first alphabet or first letter of a medical condition when it has been named after a person or a place. And these are some examples that I could find. For example, Alzheimer's disease. In this, we've capitalized the first alphabet because it's based after a person. Crohn's disease, Hodgkin lymphoma, Turner syndrome, Ebola virus disease, Zika virus. Can you think of a few more names? Can you think of a few examples? Any medical condition that's based after a person or a place? Parkinson's disease, very good, Pivai. Down syndrome, very good. Okay, I don't think measles is based after a person's name, is it? So it would be a good idea for you to check this. I don't think, yeah, measles is not. Hypertension, measles, hypotension, diabetes, these are conditions that are not based after a person's name. So you do not need to capitalize the first letter. It would be a good idea for you to maintain a list in the notebook. And if you're confused, check and then make that correction accordingly. Make a note accordingly. Very good. Thank you for all these responses. Everyone, we have really good examples in the chat box as well. Please make sure that you look at them and make a note if you find them useful. But I hope that the rule that we're discussing here is clear. Only capitalize the first letter or the alphabet of your medical condition if it's based after a person or a place. The second one, we will capitalize the first letter of a species of bacteria like E. coli bacteria or salmonella. So we capitalized S, or S. aureus. So when it's a species of bacteria, capitalize the first letter alphabet. Third one, for medications, when you're mentioning medication names, capitalize the first letter only when referring to brands. Do not capitalize when you're referring to active ingredients or salts.
लाइव क्लासेस चल रही हैं
Dr. Gopal, can
लाइव
I
क्लासेस चल
request you
रही
to mute yourself, please?
हैं कुछ नहीं पता भी नहीं चलेगा आपको
Okay. So for example, look at the 4 names that we have on the screen. Panadol. This is a brand name. That's why we capitalized P. The salt, it's paracetamol in Panadol. So the salt or the active ingredient, for that you don't need to capitalize the first letter. Then Advil. Advil is a brand name, so we capitalize the first letter. The salt is not. For Ventolin, salbutamol, S is not capitalized. Tylenol, it's a brand name, so T is capitalized, but it's salt, acetaminophen, that's not capitalized. Again, this would be a good idea for you to note these down. Maintain a list. If you get confused, start maintaining a list when you're preparing for the exam and revise that once a week before the exam so that you remember. Here's an activity for you. And I've also done an example, the first one. So if you look at the phrase in red, dear Dr. Sharma, this is not correct because one, for the salutation, D will be capitalized. For dear, D would be capitalized. Then doctor's D will also be capitalized. When you're mentioning the salutation, Mr., Miss, Doctor, Professor, first letter, it's capitalized. So for Mr., M will be capitalized. For Miss, M will be capitalized. For Prof, when you're writing for Professor, P will be capitalized. And then because Sharma is a surname, it's a proper noun, that's why S will also be capitalized. That's why this will be the correct form. Dear, D capital, Doctor, D capital, Sharma. Now I want you to correct this, and it's a very easy activity. Mr. Wilcox takes metformin for his diabetes. If you feel there is some error of capitalization, please correct it and type your answer in the chat box. Okay, Ashish, can you write the complete sentence, please? I will come to your questions, Amit. Can we first do the activity? All right, very good, Kamal. Mr. Wilcox, and W is capitalized, yes, takes metformin for his diabetes. Yes, very good. This is the answer. Mr. Wilcox, because Wilcox is a proper noun, right? Last name of the patient. So we will capitalize the first letter, but we will not capitalize metformin. This is an active ingredient in medication. And diabetes also, the name of the medical condition is not based after a person's name, so it will not be capitalized. Now we have very interesting questions in chat. I will read those out and then we can discuss them. The first question is, ma'am, after signposting phrases or after a comma, can we use pronouns like he or she in capitals? No. The first letter of your sentence, when you start your sentence, that's capitalized. And then after that, learn about the rules of capitalization. If it's a proper noun, yes, we will then capitalize the first letter. He or she is a pronoun, so no. So just to give you an example, let's go back to the previous activity that we were doing. Now look at the paragraph on the right-hand side. During her initial visit on 7th Feb, comma, she is the S capital? No, small case. So I hope that answers your question. Then another question is, Amit, I would want you to rephrase your question if that's okay. I'm having trouble understanding what it means. A in the body of the letter. So see, what I would want you to do is, after this class, if you have confusion about when to capitalize, I would want you to, for those of you who are not a part of our classes, I would want you to Google rules of capitalization. For those who are studying with us, I will send you a lecture on capitalization and its rules. Proper nouns, okay, that, and 3 very common important factors that are relevant to OET we've discussed. But I would want you to revise these rules and then be mindful of this when you're proofreading. Okay, now I'm quickly going to jump over this section because if you have problems with or confusions about when to use for, since, or ago, you can refer to this booklet. I've included an explanation along with the example, and we will go straight to the activity. Now, let's first discuss an example. Suppose this is the case note, 2018 Feb myocardial infarction. If I transform this, she or he or the patient suffered a myocardial infarction in February 2018. Just imagine, for example, if the case note was 2 years before dash myocardial infarction. How would we write that sentence then? Krishna, the second one is correct. Second one. Dear, because you're starting with dear, so D would be capitalized, and Amit is a proper noun, so A will be capitalized. So the second one is correct. So how will we write this set of case note? 2 years before dash myocardial infarction. How will we write that? The patient suffered a myocardial infarction 2 years ago. Because that action has finished, we use ago when we're talking about when an action was completed in the past. Now, I would want you to do these 3 exercises that we have. Let's take it one by one. 1995 dash appendectomy. Can you please expand this into a sentence? She had appendectomy in 1995. Very good. The patient, what would be the right verb? Would it be undergone, undergo, underwent? What will be correct? This action is finished, right? It's finished in the past. And if it's resolved, you can use simple past. So underwent, very good. She underwent appendectomy in 1995. And if I replace 1995 with 5 years before, 5 years prior, appendectomy 5 years prior, how will we write this then? Five years ago, yes, she underwent appendectomy 5 years ago. Very good. Then the second one, today. Toothache started last week. So today means this note is being recorded today in your case notes, and the patient has presented with toothache, which started last week. How will we expand this into a sentence? Sorry. Okay, let me give you two options. You can choose one and then type that as your answer. She has had toothache since last week. For full stop. This is the first answer. Second one is she had toothache since last week. Which one is correct? The first one is she has had toothache since last week. Full stop. She had toothache since last week. Which one is correct? Very good. Excellent. The first one, present perfect. And we're using since because we use since with perfect tense, with present perfect tense to talk about when this action began. When this action began in the past. So she has had, that's your present perfect. Just going to mute the students. Okay. She has had toothache since last week. Very good. Then the third one, March 2021, hospitalized for pneumonia, discharged after a week. This action started and ended in the past. Which tense will we use? Present perfect or past simple? Simple past. Very good. And how will we write this? All right. She was hospitalized for treatment of pneumonia for a week in March 2021. So we'll use simple past for this. Okay, now let's see which tense is to be used when you're writing about a patient's diagnosis. Use past tense when you're describing an event in the past which is resolved, which started in the past and which was resolved in the past. Like Mrs. F gave birth 5 weeks ago. Past tense can also be used in a similar way with diagnosed. Mr. G was diagnosed with pneumonia and treated with antibiotics prior to discharge last week. It's also possible to use past tense when the situation is ongoing but stable. Ms. J was diagnosed with diabetes in 1998, for which she takes regular medication. Then where do we use present perfect? One, when the condition is unstable. Mr. H has been diagnosed with asthma and prescribed an inhaler. This conveys to the reader that this condition of asthma is still unresolved, that the treatment is ongoing, but it's unresolved. So condition is unstable. That's why we're using present perfect here. He will return to the outpatient clinic next month for a review of the inhaler's effectiveness. Situation 2 is when the condition will be news to the reader. This is particularly true when the reader already knows the patient, so you're telling them something new. For example, think of a context where a patient has been transferred to your care from a retirement home. Now you are sending the patient back to the retirement home, but you're writing a letter for follow-up care, for continuing care. So Miss W was admitted to hospital 3 days ago. She has been diagnosed with unstable angina and requires your follow-up care. So if you are referring your patient back to a reader who knows the patient, then you can use present perfect to give the piece of information that will be new to them. Something they would already know till the time the patient was in their care. When the patient was referred to you and the patient starts their care with you, after that, there will be some information that will be unknown to the recipient, to the reader. That information you can present in present perfect. Okay, let's do an activity for this. First one, and good that we have the answers already. You just have to choose one, very easy. She underwent, past simple, or has undergone. Present perfect. She dash surgery to pin the fracture, which was confirmed to be successful by a post-operative X-ray. Which tense would be appropriate here? So what will be the correct answer? If the situation is resolved, then which tense do we use? Past simple. So underwent is correct. And then let's look at the second one. He dash Panadine Forte and encouraged to take this as required for next 7 days. Which tense do we use when the condition is unstable? Present perfect. So, very good. Yes, has been prescribed is the correct answer. Excellent job. Okay, the third part of this lesson, which is about connecting your ideas logically to prioritize key information. Use sentence variety to highlight key information. The range is not important. Appropriateness is. What do we mean by this? See, it's a common misconception for people to believe that you have to demonstrate a range of grammar. I think more than that, it's important to think about appropriateness of grammar. So when I say use a variety of sentence types, I want you to also be mindful about why do we use a particular sentence type. You should think about that and then decide which sentence is to be used for conveying information to the reader. So there are 3 types of sentences that we use: simple, complex, and compound. Let's understand where each type of sentence is to be used. And that is more important rather than mindlessly just using different variety because you want to demonstrate a range. I don't think you should do that. I think you should think about where is it appropriate to use a particular sentence type and then use it. So simple sentences are to be used when you wish to express a single idea that is complete in itself. A complex sentence is used to combine 2 sentences or 2 pieces of information or 2 ideas that are related to each other, but you feel one idea is slightly more important than the other. A compound sentence is used when you're combining 2 sentences or ideas and both are equally important. Now let's see an activity for this. The context is Mr. Shah lives in a retirement home. And is returning after a knee replacement operation. The charge nurse who is writing this letter wants to tell the resident nurse about the patient's current condition. Here are the two pieces of information that the nurse has to include in the letter. The first one is Mr. Shah can ambulate independently. The second is he needs a walker when outdoors, and then bracketed information is in the garden. First of all, my question to you is, are these ideas related or should they be written as two separate simple sentences? What do you think? Do we need to combine them? Are they related to each other? They are related. Very good, Raman. Yes, Anjana. Good, Meenakshi. They're related, right? They're about patience, mobility. So they're related. Now, when you combine them, do you think they're equally important or one idea is slightly more important than the other one? If you were the recipient, would you find one idea or one piece of information more important than the other one? Okay, many of you think it's equally important. Okay, Kulvinder, which one is more important in your opinion? Meenakshi, this question is for you as well. Kaval, okay. Kaval says second one is more important. Pinky also says great, good, Anjana. Great. See, while both are important, of course, anything that we include in the letter is relevant, right? But the second piece of information, that this one, he needs a walker when outdoors. This is slightly more important. This deserves greater attention from the reader because Mr. Shah, if he goes outside without a walker, he could injure himself. That's why when we combine them, we will be using a complex sentence, not a compound sentence. And let's see how we can do that. Although Mr. Shah can ambulate independently, comma, he needs a walker when he's outdoors. I've also written the compound sentence for combining these, but what would be more appropriate? Complex would be more appropriate. Because when you use a complex sentence to combine the information, this conveys to the reader that the independent clause in the complex sentence deserves greater attention. And now let's see, how do we decide how to put the more important idea and how to put the less important idea in the complex sentence. The more important idea will be your independent clause, this one. He needs a walker when he's outdoors. The less important idea is it always starts with a subordinating conjunction. If you are a little unclear about how complex or compound sentences are formed, I will share a lecture after this class, and that is something that's an important lesson from exam point of view. So I would want you to get your basics correct about how do you about the structure of these sentences. How do you form a complex sentence? How do you form a compound sentence? So complex sentences are formed using subordinating conjunctions. Compound sentences are formed using coordinating conjunctions or conjunctive adverbs. So if you want a lesson about how to write or how to create these sentences, I'll share that with you. But important thing for this lesson is when you've decided there are two pieces of information, they are related. One is more important than the other. Then the more important idea is your independent clause. The less important idea becomes your subordinate clause. And that always starts with a subordinating conjunction, which in this case would be although, because the relationship between the ideas in is contrast to each other. That's why we used although. Although is in spite of the fact. That's what we discussed earlier, right? The purpose of subordinate conjunction, although in this example, is to subordinate. In other words, subordinating conjunction in a complex sentence assigns a lower grammatical status to the subordinate clause. That is why a subordinate clause can also be called as a dependent clause because it depends on the independent clause to complete the sentence. So this is what we just discussed. How do you know which clause to subordinate? Think which deserves greater attention from your recipient. Now let's do an activity which will probably add clarity about what we're discussing. Read the information for this letter. Then decide which type of sentence would you use to communicate your message effectively to the reader. The writing task is that you are the head nurse writing a letter of referral to a chest specialist in another hospital about Mrs. Howard, a patient in your care. Purpose is, there is a strong possibility that Mrs. Howard could have cancer, but you want to refer her to a specialist to make a more accurate assessment. So the purpose of writing is assessment. The two pieces of information that you have to include are that she is a regular smoker and she has a family history of cancer. Now, my first question to you, are these related? Should we write them as two simple sentences or should we combine them?
We can combine them.
Can combine them. Wonderful. Can I request you to type in your answers in the chat box? Combine it. Okay, very good. I think everyone agrees. And if we are to combine them, my next question to you would be, are they equally important? Keep in mind the purpose of writing. The purpose of writing is assessment because her symptoms are consistent with cancer. There's a strong possibility that it could be cancer. So we're referring her for assessment. So in your opinion, are these pieces of information equally important or one of them deserves greater attention from the reader? Very good, Meenakshi. Meenakshi says equally. Oh, I'm glad everyone agrees on one answer. Yes, they deserve equal attention. They're equally important. So what kind of sentence will we use? Compound. Very good. So this was the sentence. She is a regular smoker and her family history is remarkable for cancer. I'll just correct this. And this is the coordinating conjunction that we used for our compound sentence. And. Okay, the second activity. You are a charge nurse writing to a social worker about a patient, Miss Diamond. The purpose of writing is that you need to give a brief social background of the patient so that the social worker can help the patient in getting the right support. The two pieces of information that we have to include are that the patient has been offered counseling help numerous times. The second information is that she has refused counseling. First of all, are they related? Yes, they are related. Very good. And if they are related, are they equally important or one piece of information is, one idea is more important than the other? And if yes, which is the more important idea? And Raman, which is the more important idea? Please type that as well. That she refused counseling. Very good. 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 Well done, lovely. Well done, Krishna. Well done, Ashish. Yes, that's the correct answer. Okay, good. See, I have written all three sentences. The first is two simple sentences. The second is The second is where we have written it as a simple sentence. The third, we have written as a complex sentence. Now, if one idea is more important than the other, which type of sentence would be appropriate? Complex or compound? Complex. Very good. That's why third one is the most appropriate way. I will not even say correct, because all of these are grammatically correct. They're all grammatically correct. But now it's more to do with appropriateness. What is the most appropriate way of conveying this information to the reader? And that is the third one. Because when you write in number 3, that will convey to the reader that this deserves our attention. Ms. Diamond has refused counseling. Although it's been offered in the past, currently refused counseling help. All right, any questions about this? Because I know this is something that you may be unfamiliar with. Any questions about types of sentences, about the appropriateness, the usage? Great. Okay, Krishna, you're asking in spite can we use in the third sentence? So the phrase is in spite of something. You can use it, okay, but in complex sentence, we use subordinating conjunction. So although is a subordinating conjunction that we can use when we're using contrasting pieces of information in a complex sentence. If you, and we also must keep in mind, we talked about conciseness as well. So I don't think it would be, I mean, although it will be correct, no doubt, but since we're talking about making it as clearer and as concise for the reader, so I would prefer if we can do it in the example number 3 in that way, rather than using that phrase, in spite of this. Okay, then the fourth one is informality of language. First one is maintain a formal tone. This is something that you must do, which means avoid contractions. What are contractions? Shortened forms. So like is not becomes isn't. Do not becomes don't. While this is okay in informal language and when you're speaking, that's fine to use contractions then, but don't use it in formal writing. So avoid contractions. Then avoid slang, avoid colloquial expressions, phrasal verbs like throw up or pass out, etc. What is an example of colloquial words like tummy for abdomen? So we must avoid colloquial expressions. Informal language, pass away for die. Use an appropriate level of formality. Now, if you see the two examples that are mentioned on the screen, the meaning is the same. The only difference is in the word or the verb. In the first one, in the more formal variant, the verb used is indicated. In the second one, in the informal variant, it's showed up. So when we're writing, especially in the writing subtest, we'll go with the formal variants. So in the first aspect of a lesson, also in the first, when we were discussing about conciseness and clarity, one of the tips was prioritize precision, word precision. So this is what I mean. rather than using phrasal words that are informal, use words that sound formal. Transform note form or shorthand in case notes to complete sentences, and avoid abbreviations, symbols, short forms, even if you see them in the case notes. If you see an upwards arrow, that will be increased or elevated. Don't use an arrow. Don't use this as it is from the case notes. So any symbols, you transform them, you use a word for it, for symbols. For abbreviations or for acronyms that are globally accepted, and if you feel they'll be known to the recipient, you can use them. For example, capital B, capital P, BP. I think this is a globally accepted acronym for blood pressure, so that's fine. But any other abbreviation that you feel will not, something that your recipient may not be familiar with, or will be difficult for the reader to understand, that should be avoided. Use medical or discipline specific jargon appropriately, considering the recipient's job and their level of familiarity with it. So, Pallavi, I will answer your question. What do we mean by this? Now, this is a common question. Can we use medical language in our letters? It will depend on whom you're writing to. For instance, if you're writing to a specialist, then you can use technical terms, you can use medical words. In fact, in that case, if you use non-technical words, I think it would make your letter informal. So always be mindful of who your recipient is. If it's a GP, you decide what are some commonly accepted abbreviations or medical terms that will be within the scope of what GP practices, and include them. If it's too technical, too specialist, something that's relating to a specialization of medicine, you can avoid that. So think of it from this perspective. The question that you should be asking yourself is, this medical term, will the recipient be familiar with it? If yes, then use it. If you're in doubt about it, then you use a simpler term for it. Avoid impersonal perspective, which rarely uses any personal pronouns like I, we. So avoid that. In fact, you should avoid judgment as well. No positive or negative judgment for the patient. Now, Pallavi has a good question. How can we use due to in informal form? Owing to? And how do you decide? I have a question for you all. How do you decide what is formal or informal? I have a suggestion for this. You should maintain a notebook for new words that you learn, or as a vocabulary bank of sorts, and have a good dictionary with you. Yes, Ashish, I will do that. Have a good dictionary. And anytime you learn a new word, check its register in the dictionary, whether it's formal or informal, and note that down so that when you reuse it in future, you keep that in mind. In spoken English, it's absolutely fine if you use informal words, even in your OET speaking. But it's just for the writing subtest that we're discussing the difference between formal and informal language when deciding the choice of words. So I would like you to do this. If you haven't been doing this, please start doing this now. Okay, Ashish, ma'am, will you please give an example for being judgmental? Yes. For example, let's say your patient is a smoker. You are writing to a social worker for a smoking cessation program, and the patient, despite your advice for ceasing smoking or giving smoking, the patient is reluctant, or the patient is adamant on continuing to smoke. So in that case, a judgmental response could be unfortunately or regrettably, which means that you're unhappy with this. So avoid that judgment. You don't want to sound judgmental for your patient, because judgment, what is judgment? It is sort of giving your opinion about patients' choices, about their lifestyle choices, and we don't do that, neither in the speaking subtest nor in the writing subtest. Okay, Dr. Aman, can you use a medical term if you are writing to a specialist surgeon? Yes. Yes. In that case, it would be better to use a medical term because a surgeon would be aware of the medical term. All right. We have an activity now. Okay. The other questions I can take up later. Make sure that you note down your questions so you don't forget them later, and you can always write them in the WhatsApp group as well. So I will respond there. So this is an activity that we'll do now. We will see two extracts of the same letter. As you read, think about appropriate use of vocabulary and level of formality, and let me know which, in your opinion, is more appropriate for the reader. You are writing to a head nurse at a community retirement home. This is a discharge letter. So that's your recipient. Now I will give you 2 minutes to read both the versions. Then you will decide which is more appropriate, which is more appropriate in level of formality and the level of vocabulary used. Okay, very good. Very quick answers. Yes, the first one. See, it uses appropriate technical terms. Let's go back and see the examples. The second one is using terms like blood pressure, right? Or if his weight remains unchanged. Even in terms of conciseness, but this is the one example that I can find. And for diabetes as well. See, in the first extract, we've used words like hypertension and diabetes mellitus because our recipient is a health professional and the recipient would be able to understand this. So keeping that in mind, we've used medical terms rather than these layperson terms like blood pressure or diabetes. Then if you look at style of writing, compare this. If morbid obesity persists, compare this to this. If his weight remains unchanged, which one sounds more formal? The first one. Then please encourage daily exercise and stop him from eating foods he is not allowed to eat. Compare this to this. Please encourage daily exercise and continue dietary restrictions. Which one sounds more formal? First one. Extract B uses non-technical vocabulary, even though the recipient is a medical professional, not only reducing its appropriateness, but also decreasing its formal tone. The difference is subtle, but remember your goal should be to create a formal letter that your audience can understand. Then we come to the final section of this lesson, which will be on incorrect punctuation. Now, there are different punctuation tools that we can discuss, but here in today's class, we're only discussing commas. But I would also like you to understand rules of usage for apostrophe and semicolon and colon, because you can use them in your letter. Okay, so please make a note of it. Apostrophe and using a colon, especially when you have to expand on something. Then for a semicolon, for combining sentences that are closely related to each other. Okay, we're going to discuss 5 rules for comma usage. The first rule, put a comma after a discourse marker or a time order word, or a phrase that precedes, the meaning of the word precedes it comes before. That comes before the subject at the beginning of a sentence. So for example, here Mrs. Davies is the subject of a sentence. And this word, currently, this time order word is preceding the subject. So we will separate anything that comes before the subject with a comma. Then the second rule, put a comma to separate the dependent clause and the independent clause in a complex sentence if the dependent clause comes before the independent clause. See example number 1. I already discussed with you which is the dependent and the independent clause, right? The dependent clause is the one that starts with a subordinating conjunction. So this is our dependent clause. Although Mrs. Davies has progressed well. And this is our independent clause. She is currently dependent on a worker for mobilization. Now the rule is put a comma to separate them if the dependent clause comes before the independent clause. So here in this case, the dependent clause comes before the independent clause. That's why we are separating them with a comma. Do not put a comma between the dependent and the independent clause if the independent clause comes before the dependent clause. So if the order is reversed, if this complex sentence starts with an independent clause, then we don't separate them with a comma. So see, both are complex sentences, same pieces of information. The only difference is the order. Here, in this second example of the complex sentence, Mrs. Davis is currently dependent on a worker for mobilization, although she has progressed well. Full stop. So this is the rule. Then put a comma before the coordinating conjunction in a compound sentence. Do not put a comma when the coordinating conjunction joins 2 predicates in a simple sentence. See, a simple sentence has 1 subject. A compound sentence will have 2 subjects that you're joining together. Now let's see the examples. Her home is not set up for a worker. This is the first idea in a compound sentence. Her elderly husband will not be able to care for her at home. This is the second idea in a compound sentence. We are joining them together, and because they're equally important for the reader, we have joined them using coordinating conjunction to make it a compound sentence. And how do we join these ideas together? Using a comma and a coordinating conjunction, appropriate coordinating conjunction. So because this is an addition of information, so we're using and. Her home is not set up for a worker, comma, and her elderly husband will not be able to care for her at home. This is a compound sentence. But look at the second sentence. Here, this is a simple sentence with 2 predicates. Simple sentence with compound predicates. So when this happens, then you just join them with and. No comma is needed here because the subject is the same. Okay, Sudesh has a question. It would be greatly appreciated if you could provide further care. In this sentence, prior to if, no need of comma. Okay. Okay, hypothetically, let's say you are writing, yes, this sentence in itself is correct. It would be greatly appreciated if you could provide further care. Why? Because if you could provide further care, this is your dependent clause. And dependent clauses, is it the first or the second? It's the second one, right? So rule number 1, this one that we discussed. Sorry. Rule number 2, the first point of rule number 2. If the dependent clause comes second and the independent clause comes first, then, if the dependent clause comes second, then they are not separated with a comma. That's why it will not be separated with a comma. Hypothetically, if you were to reverse it, if you could provide further care, comma, it would be greatly appreciated. Then they will be separated, because in that case, the independent clause would come first. The dependent clause would come first. I will actually write this down in the chat. The dependent clause here would be if you could provide further care. This would be our dependent clause because this is beginning with if. Then it would be greatly appreciated. This would be our independent clause. Now the rule is, if the dependent clause comes first, then they are separated. Then this sentence would become, if you could provide further care, comma, it would be greatly appreciated. And if the order is reversed, then there wouldn't be a comma, because if the independent clause comes first, then there is no comma between the ideas. Is that clear? Okay. Then we've already discussed about the coordinating conjunction. When we join two ideas together in a compound sentence, we join them using a comma and the coordinating conjunction. And when it's a simple sentence with two predicates, then we don't use a comma. If you are joining three or more predicates, then in that case, yes. In that case, yes, there would be the first two predicates would be separated by a comma. The last predicate would be separated by Oxford comma and that is the next rule that I'm coming to. So put a comma to separate three or more items in a series. These items may be words, phrases, predicates. The last item is separated from the list with a comma and. So for example, look at the sentence. She suffers from osteoporosis, hypertension, mild hyperlipidemia, and coronary heart disease. There are 4 items in a list. We are separating the first 3 from each other using commas. The last item in the list is separated from others using a comma and. And this comma is called Oxford comma. Okay, just a minute. Now I wanted to talk about predicates as well. For example, look at these 3 sentences. Okay. Is the subject same for all these sentences, and can we combine them? Yes, we can. So let's combine them. She is married. We can combine the predicates, right? If the subject is common, then we can combine the predicates together as we discussed. She is married, comma, currently lives with her parents. So there are three predicates that we're combining. And the rule says that if there are three or more items, then we separate the last item of the list with a comma and the others just by using commas. So the last item here would be and. We'll shift husband's house after a week. So we've used the Oxford comma here and then and because this was the last item. So this is the rule. And then the last rule, put a comma before and after the appositive or appositive phrase. I'm sorry, Krishna, you'll have to write the complete sentence, please. Currently living. Okay, we'll come to this question, Krishna. I'm waiting for the question while you type it. Let's discuss the last rule very quickly. Put a comma before and after the appositive or the appositive phrase. If the sentence ends with an appositive or a positive phrase, then the comma following the appositive is substituted with a full stop or period. And what is an appositive or a positive phrase? It will be after a week, Sandeep. And a positive or an appositive phrase allows us to add information without adding a whole new sentence. It is used after a noun. And a positive or an appositive phrase is used after a noun. And it lends clarity to your noun and offers a quick way for you to squeeze more information in your sentence. See, normally something that I tell for a positive usage is, this is for extra information about your noun. But even if you remove this piece, the appositive or the appositive phrase from your sentence, the meaning of your sentence should remain unchanged. So don't put key information or very important information in a positive. And a positive phrase should be used for just extra information about the noun. Yes, meaning will be the same if you remove appositives. That's correct, Dr. Aman. So see the sentence on the right-hand side. I'm writing to request rehabilitative care for Mrs. Davies. Now, Mrs. Davies is a noun, and we have added extra information about the patient, a patient of osteoporosis. This is our appositive phrase here, a patient of osteoporosis. And the rule of comma usage is that this appositive phrase will be preceded and followed by a comma. So before the appositive phrase, there'll be a comma. After the appositive phrase, where it ends, there'll be a comma. Who is recovering from a left hemiarthroplasty necessitated by a fractured left neck or femur. Then see the next sentence also. Kindly oversee her compliance with the prescribed medication regime and then attach to this letter. This is our appositive phrase. And because there is nothing following the appositive phrase, that's why instead of a comma, we have put a full stop. So this is the rule. Now, these are the 5 examples. I want you to keep in mind the 5 rules that we have discussed and then add commas where necessary. Pallavi, I'll come to your question, but let's do this first. Let's look at the first one. Although the patient was given appropriate care, his condition did not improve. Should we add a comma here somewhere? And if yes, why? Which rule of comma usage? You'll also have to state that. The first one, although the patient was given appropriate care, his condition did not improve. Is this sentence correct or is there a comma needed? Very good. Yes, you'll add a comma after care because this is a complex sentence and the dependent clause comes first, the independent clause starting from his. So you'll have to separate the dependent and independent from each other by putting a comma after care. Very good. Then the second one. The patient was very worried about the surgery and the doctor reassured him that he would be administered anesthesia before the procedure. Is there a comma needed? Yes, Sanhita, you're right. And where will you put the comma? After surgery. Very good, Meenakshi. Good, Sandeep. This is a compound sentence. How do we know this is a compound sentence? There are two different sentences. Each one has its own subject. It's a compound sentence. And the rule for compound sentence is that when you are joining them with a coordinating conjunction, that coordinating conjunction is preceded by a comma. So we'll add a comma after surgery. Good. Then the third one, Ms. Dawson has been advised to ensure her compliance with the prescribed medication regime, exercise program, and low-fat diet. Will we add comma or commas here? Yes, commas. I think it's better. I'll give you time. We're no rush. Type the complete sentence with commas. Type your responses in the chat box. Very good. Very good, Dr. Aman. Okay, so this is a series, right? Series of items, prescribed medication regime, then there is exercise program, and then low-fat diet. Compliance is needed with three things, three items in a list. So we will have to use commas to separate these from each other. So first comma will go here, second one will be here, and two commas we'll need. And the last item in the list will be separated, comma and. Okay, then the fourth one. Currently, the patient can ambulate with a wheelie walker. Very good, Sanhita. Yes, after currently, everyone has quickly answered. The last one. Mr. Jay Singh, a 60-year-old man, was admitted last night for an emergency surgery. After noun and before man. Very good. Yes. See, this is our subject or noun. This is the extra information. This is the appositive. A 60-year-old man. So it will be preceded and followed by a comma. There is one rule that we haven't discussed, which is about restrictive and non-restrictive clauses. So we shall do that in one of the classes, but you can make a note of it. Learn about comma usage for non-restrictive clauses. Okay, when you're using relative pronouns and the restrictive relative clause or the restrictive non-restrictive relative clause. So the rule is quite similar to what we discussed about a positive, but I'd like you to look it up. And that brings us to the end of the class. Do you have any burning questions that you would like to ask?